Hi, my name's Alan Taylor. I want to thank you if you watched our last video. If you didn't get a chance to watch it, please take a few minutes. It's a little bit long, but it's got an awful lot of information on whether your mask is going to help you against COVID-19. Now, I'm going to tell you right now, I've got some notes here. I don't want to get too long-winded. I know I usually do. We had planned on starting a YouTube channel. This is not it. We decided to make a couple of videos because there was a need for it. I saw some information out there that I wanted to try and correct. I hope the last video really helped you, and I hope this video helps you as well. We will be putting out a video in the very near future about what our YouTube channel is supposed to be. Follow it, don't follow it, it's up to you. If you got some great information out of these videos, I really hope it helped. Now, one of the first things I want to emphasize with this video is please stay home. If at all possible, stay home. That's the biggest concern that people are having right now, is that people are not self-isolating like they should. But not everyone can. I understand that. So if you're unable to self-isolate, keep social distance. Social distance is 6 feet away. Now, it's very easy. You're Canadians, figure this out. It's a hockey stick. Stay a hockey stick away. Now, a lot of people, while they're out there, they get very nervous and they want that extra protection. So I want to go over a couple of masks here and why all of a sudden now the Canadian health organizations are saying if you want to wear a mask, please wear a homemade mask. There's a reason for that. First of all, the medical masks that you see, N95 respirator and the medical mask, these are very important for doctors and nurses. They need these so that they can protect themselves, to make sure that they can look after us. These masks are very good for what they do. Great example, the N95 respirator. If it's fitted properly, it's going to stop as much as 0.3 microns from getting through it. That is about the size of the flu, and it's also about the size of COVID-19. So if a doctor or a nurse is wearing this and it's fitted properly, that will stop them from getting it. If you're wearing it and it's not fitted properly, it's not going to do the job. It's not going to stop you. So I'm going to demonstrate something here just to show you how good this is for doctors and nurses. When they put this on, first of all, they put it on so that they have two rubber bands. One goes above the ears, one goes below the ears. They put it over their mouth and nose. There's a metal tab. That metal tab is at the top and it goes over the nose. The bottom part, you pull it down below the chin. It has to come down below the chin. Squeeze in that metal tab. Now, if this is fitted for them properly, this is going to do a great job, and I'm going to show you how well this is going to stop things from getting through. A little bit of a demonstration here. You can see that I can't blow the light out. So this does a great job. But only if it's fitted properly. If it's not fitted properly, it does nothing. This one here is a surgical mask like you see doctors and nurses wearing throughout the hospital. If you go into a hospital right now, everybody's wearing these when they're working. Very important for them. Now, this is going to stop an awful lot. It's going to help them, especially if for any reason they wind up having a cough or a cold or anything. It's going to stop that from spreading to other people. The distance that a cough or a sneeze goes is tremendous. If you've seen videos of this happening, it goes a long distance. This is not going to stop it, but it's going to slow it down dramatically. The reason why it's not going to stop it is because it's not sealed around the mouth and nose. But what it does is when you do put it over top of your ears like this, there's a metal tab on the top. Pull the bottom underneath your chin, form the metal tab. Even though there's spots around here, you've still got a very good mask here that's going to help and stop anything from getting through. Now, again, demonstration. I still can't blow out the light. So this does a great job, and it really helps our doctors and nurses. Please leave these for the doctors and nurses. If you do want to wear a mask, there's the homemade masks. There's the ones that you can get from Home Depot. They do a fantastic job of stopping things from going too far. If you cough or sneeze and you're wearing this, you're going to stop somebody from getting the disease that you have, whether it's a cold or the flu, or at the very least, you're going to lessen the risk. Stuff is still coming out, not as far. I'm going to do the same demonstration so that you'll see what I'm talking about. I'm going to put this on. There's a single band on this one which tells you it's a dust mask. It's got a metal tab as well. Metal tab goes to the top, pinch the nose. Everything else is nice and sealed. And our little air test. See how easy I could blow out the light there? That tells you that this is not stopping as much. Again, when you're out, if you feel more comfortable wearing this, I understand. I would rather see you wear this, get your groceries and get home, than to feel very uncomfortable and worry about constantly getting something. This is going to, at the very least, reduce the risk. A lot of people have been talking about homemade masks. My wife does an awful lot of sewing, and she's done a little bit of research on these homemade masks. What she's found is this is the material. I'm not too sure what this is. I think it's a cotton, but this is the material that they are recommending that is used for making homemade masks. So I'm going to do the same demonstration. Okay, you can see I was able to blow the light out again. Clearly, it's going to slow down anything that's coming out. If you cough or sneeze, it's not going to stop it. It's going to lessen your risk. It's going to make you feel a little bit better. I understand that. That's what these are designed for. The hospitals, the Canadian health organizations are all saying use these masks because they want to save the N95 respirator and the surgical mask for the hospitals. Use these if you can't keep social distancing. If you're going to the grocery store and you feel more comfortable, by all means wear it. Remember, you could also be asymptomatic. There are people out there that have no symptoms whatsoever and they're sick with COVID-19. They just don't know it. So if they're out there and they happen to cough, excuse me, like I did, they could be spreading the virus. So wear something. If you're more comfortable with it, wear something. Remember though, if you feel sick, if you have any of the signs or symptoms, if you have a cough, a dry cough, if you're fevered, if you're achy, anything like that, self-isolate. It doesn't mean that you have COVID-19. You might just be coming down with a minor cold. You might not be coming down with anything at all. But self-isolate, minimum 14 days. And that's when you can decide if you want to go out. Now, one last thing I'm going to mention. Cross-contamination. You see a lot of people in the grocery stores with gloves. You don't need gloves if you're in the grocery stores. What you need is to clean your hands. Before you walk in, clean your hands. When you come out, clean your hands. When you're in the car, clean your hands. Clean all the surfaces using wipes or a spray that's an antibacterial spray, and you'll be able to get rid of all, if not most, of any viruses that might be around. Again, thank you very much if you watched my past video, and thank you for watching this one here. Stay safe, and if at all possible, stay at home. Thank you.